you, Tianfa. Good afternoon, ladies and gentlemen. Today our group would like to present about Bovine recurrent vaginal prolapse. Here's our team. We have Ms. Kanatawan, Ms. Tananya, Ms. Pinyapa, Ms. Kanjanarat, and me, Ms. Professor. Okay, let's begin. At first, we only knew that there's a couple struggling with the problem of recurrent uterine prolapse, as the owner said. And then Agent Oat gave us a bit more information about the case. So here's Malik. She is female cattle of Indo Brazil, class Gr.1 breed, and she's 5 years old and weighs about 300 kilograms. She did Tokyo once at her first pregnancy and never get pregnant again after that. We wanted to know about the timeline of this case, so we did interview the owner on the phone. And she said she bought Malik from farm, and Malik was clinically normal at that time. After that, Malik hit puberty, so the owner did artificial inseminations, and she got pregnant. At her last trimester, her vagina prolapsed, so the owner called DLD for help, and someone came. He pushed the vagina back without any aseptic technique. At the time of cupping, she couldn't cup normally, so someone from the LD gave her a shot of oxytocin to help push the cup out, but at the end the cup dead. She still had prolapse after dystocia, and someone from the LD treated her by suturing with simple interrupt patterns. At the 5th prolapse, the owner couldn't stand with her conditions anymore, so she sent her to Prasupala Animal Hospital, and Malik was diagnosed with vaginal prolapse. On 22nd of June, the owner admitted her for the first time. Malik had vaginal prolapse starting 2 months ago, and there's a wound at vulva, so the owner applied gingival on it. For previous treatment, the vulva has been sutured 2 stitches across it with simple interrupted suture actually. On physical examinations, Malik appeared to be bright, alert, and responsive. We found infected wound and pus at vulva, and when we ultrasound, we found the pus in the uterine horns and found 1.5 centimeter follicle in the left ovary and 1.3 centimeter corpus luteum in right ovary. And the veterinarian diagnosed with endometritis. For treatment, we removed suture material and dressed the wound, and also plan to lavage the uterines and collect the blood in the next day. Here's the sample of ultrasound image of endometritis and pus in the uterine horn. On 23rd of June, the private clinicians treated her by dressing the wound with chlorhexidine and applied Bovine iodine, and also collected blood for complete blood count analysis. And this is the result of complete blood count analysis. We found mild increased band neutrophil, erythrocytosis, decreased MCS and MCSC, and also the thrombocytopenia. These all can be caused by acute inflammation, dehydration, iron deficiency, and infections and hemorrhage, respectively. On 24th of June to 2nd of July, the clinicians only dressed the wound with chlorhexidine and applied Bovine iodine on the wound. And on 3rd of July, he examined Malik, and she appeared to be bright, alert, and responsive. Not only she can drink and eat normally, but also urinate and defecate. There is no pus outside, and the wound was healed, but there's still a bud in the uterine horn when we ultrasound, and we found 0.9 centimeter follicles in the left ovary, and the right ovary was moved. For the treatment, the clinician dressed the wound and also lavaged the uterine with 1% glucose iodine solutions. She had been discharged when the wound was healed, and the clinician made an appointment for follow-up in the next 2 to 3 weeks to monitoring the effects of uterine lavage. On 11th of July, Malik was admitted for a second time because of her vaginal prolapse. She was good on physical examinations, and We know that it's a vaginal prolapse because there is no caruncle on the surface of tissue and it's not long access to the heart. From history, we think it's a continuous prolapse of vagina, urinary bladder, and cervix, so we classify it as a third-grade vaginal prolapse. The clinicians treated her by blocking nerve using color epidural nerve block technique with 2 milliliters of 2% lidocaine hydrochloride and manually push the vaginal bag into normal positions and suture beside the vulva with horizontal thread suture pattern and also dress the wound with povidone iodine. And this is the picture showing horizontal menstrual suture pattern that the clinician used. The possible cause of this case can be originally induced by first, inherited trait, second, predispositions, and third, increased intra-abdominal pressure in late pregnancy. And from dystocia, she was helped by extracting fetal forcefully, which can cause pelvic structure trauma. And that's the reason why she's continuing has vaginal prolapse. Next, Gr.1 will tell you about the follow-up of this case.
The follow-up in July 20, 2020, the wound was healed and had filled passed, so the veteran decided to remove the suture material and dress the wound, and plan to wound dressing once a day until it was healed, and follow up for 2 weeks to check if it prolapsed again. And the prognosis of Marie is good. Next is the additional information. We had searched for the etiology and other treatment of vaginal prolapse. The etiology of the vaginal prolapse we divide into 6 causes. The first cause is the predisposition such as Brahman, Charlet, earpod, short horn. And the second cause is the increasing intra-abdominal pressure such as the car with the late pregnancy term or from the intra-abdominal fat or the rumen retention. The third cause is from the anatomy of the cow such as poor vaginal conformation, incompetence of the constrictor vestibular muscle and constrictor vulvar muscle. The fourth cause is the nutrition such as lower calcium to phosphorus ratio or hypocalcemia. The fifth cause is the estrogen from endogenous or exogenous source such as the cow that feeds with the clovoplasma or moldy maize and barley, or the cow that repeats superovulation, and the cow that in the late pregnancy term. The other cause is such as older cow or cow carry the twin. The older treatment of vaginal prolapse, we divide into 2 techniques, the retention suture technique and the permanent fixation technique. The retention suture technique can divide into 2 methods, vertical method and horizontal method. The vertical method such as lunar suture technique and horizontal method such as bottle technique for lactic and rootless retention suture. The vertical method first is the lunar suture technique. This is the most popular technique to use to correct the vaginal prolapse. The indication of the method such as uterine prolapse or the vaginal prolapse to prevent the uterine and vaginal eversion. The advantage of the method such as minimal invasive and less infection. Disadvantage of the method such as it's difficult to urinate or has many complications such as perivulvar edema, pain, staining, dysphoria, prolapse, and abscess. And this is the case report that used lunar suture technique to correct the Grade 1 of the vaginal prolapse in a physician causeway in Nigeria. This is also the case report that used lunar suture technique to correct the vaginal prolapse in a cow in Bangladesh. The horizontal method versus the bottle technique. This is the Thai technique, but disadvantage of the technique such as it can cause trauma and invasive and can tip and categories of the vaginal into the abdomen and can damage to the shelving nerve or internal pudendal artery. The second method is the thoracic. This is the common technique used to correct the vaginal prolapse in the prefective. This is the Thai technique, but disadvantage of the method such as it can cause the vulvar tear, and if not placed the prolapse is sufficiently deep, it can cause a tear too. The third method is the rootless retention suture. The advantage of the method is easy to apply and not impair muscle circulation and cause edema. Disadvantage of the method is if the pattern is too tight, the vulva will reverse. This is the case report that used bootleg retention suture to correct the recurrent vaginal prolapse in a postpartum liver buffalo. The second technique is the permanent fixation. First method is the transvaginal cervicopexy. The indication of the method is vaginal prolapse associated with excessive redundancy of the ventral vaginal wall. The advantage of the method are easy and less invasive, but disadvantage of the method such as the increasing the risk of entrapment of the urethra and risk of sepsis. The recommendation to prevent the vaginal prolapse, for example, restriction the cow from becoming overrun fat during the third trimester of the pregnancy, and don't leave the cow that experience of vaginal prolapse because she can cause the vaginal prolapse again, and this is the inherited case. The last one is avoiding dietary deficiency of calcium and diet that excess estrogen. And this is our reference. Thank you, Dr. Chawarik Nathong, Dr. Sarawut Patrick Norris, Dr. Sikkamun Thanasat, Dr. Suthai Lai Kamai, Dr. Lalika Majid to give the informative advice. And thank you for your attention. If you have any questions, we will be glad to answer.